Hello and welcome to See What We See with Lauren and Martin. My name is Lauren Cashin. I'm the Executive Director of the Ontario Opticians Association, and I'm here with my co-host, Martin LeBeau, Deputy Executive Director of the Ontario Opticians Association. Hello, everybody, and welcome to today's episode of See What We See with Lauren and Martin. Today's episode is brought to you by Novartis Ophthalmology. So how you doing, Martin?
I'm excellent. How about yourself, Lauren?
I'm doing great, thank you. Today we're going to talk about dry eyes. And dry eyes are something that I've dealt with myself and I've also dealt with in my practice. Martin, have you found that dry eyes plays a role in your problem solving with your patients?
Yeah, actually every day, especially since we've been wearing masks full time or close to full time.
Right, the mask issue is making it even worse. The working at home, staring at computers, the digital devices, handheld, well, I think that's been going on for a while now. So yeah, we thought today we would focus on this issue. And we have a guest, we have Dr. Nisara Bandali. But I think first what I'd like to do, Martin, is I'm going to read a definition of what dry eye is, and then we can kind of go from there, okay? So, according to the Tear Film and Ocular Surface Society in a 2017 paper, this is what they had to say, and I'm just going to read the whole thing here. It is a symptomatic disease characterized by a vicious cycle of tear film instability and hyperosmolarity, which leads to increased ocular surface inflammation, damage, and neurosensory abnormalities. Moderate to severe DED is associated with significant pain, limitations in performing daily activities, reduced vitality, poor general health, and often depression. Wow, I've never thought about my dry eyes in those terms. How about you?
Definitely not. I mean, this is a mouthful of words there. I mean, you and I, we know what dry eye is because like you said earlier, we see it in our practice all the time. But maybe this is the perfect opportunity to bring in our guest. Would you do the honors, Lauren?
I'd love to. So our guest today is Dr. Nisara Bandali. Nisara is a primary care optometrist, and she has a focus on dry eye disease and pediatrics. So Nisara, welcome to the show.
Hi, thank you so much, Lauren and Martin, for having me.
Great to have you here. Martin, where do you want to start with Nisara? Maybe we should start at the very beginning. Do you know what I'm alluding to, Martin?
I think I do. So, Nisara, can you just break this definition down for us? Maybe like, I wouldn't want to say dumb it down, but close to it.
Sure. So I know that was a mouthful and it sounds so scary. And to just a general person who has no experience in optometry, ophthalmology, opticianry, any of these things, it sounds really scary. And honestly, it can lead to the scary stuff if we don't take care of it. So we're going to start, when I have a patient who has dry eye or is sitting on my exam chair and, I have to explain dry eye to them in a normal sense. I basically, I pull out an image. I like talking about image, in front of an image. In front of the patient, I like pulling up an image. However, because this is a podcast, I'm going to describe the image. So basically, the eye consists of a tear film. The tear film protects the cornea and the other eye structures, from bacteria, allergens, foreign bodies, dust, etc. It also keeps the front of the eye moist and clear and prevents scarring of these tissue. So the tear film is a gradient which consists of a mucus layer, which comes from the goblet cells. So the mucus layer is a little bit sticky. That sticky layer holds both the corneal tissue as well as the next tear film, which is the aqueous layer, which is also secreted by certain glands. And then finally, over the aqueous layer, we have an oily lipid layer that comes from something we call the meibomian glands on the lid margins. So this is a gradient of tears that are located right in front of the eye, and you'll notice every time you blink, there's a little bit of wetness on the eye, moisture on the eye, and that is what that consists of. And again, if the integrity of any of these layers is compromised, then it can cause signs and symptoms of dry eye and a lot of discomfort.
I have a
So,
question for you.
sure.
I'm interjecting here.
Yeah.
You mentioned where one of the layers of tears come from. Where do those, you mentioned watery, where do those watery tears come from? And are they the tears that we cry with, or that's all they're good for, is just for crying? Or you mentioned 3 layers. So you mentioned where one layer comes from. I'd be curious to know where the other layers come from. And what about these tears that come down when we cry for different reasons?
So those are actually, they come from different glands. So the moisture tears, they come from the glands that are located on the eye itself. There's glands of Wolfram, there's other glands of Krauss, there's different glands that produce these watery tears that come out. Now, when we are crying, that comes from the lacrimal gland, which is located just in this orbital bone area, just under the brow area. And that's secreted by a whole different ball game, I guess, a whole different innervation system. And when patients do suffer through dry eye, they say, my eyes are not dry, they're wet. I'm tearing like crazy. There's no way I have dry eye. And that's when I have to explain that the eyes are so dry. They're so dry that your brain is sending out the crying tears to protect the eyes, because the eyes need some sort of moisture. And when this gradient that I speak of, the tear film that I speak of, is affected or is compromised, where you have too much mucus or too little oil, or too little water or too much water, it causes these symptoms and these issues. And this compromise can also cause a lot of other things, which I'm sure we'll get into later. So they're 2 completely different tears that are present on the ocular surface. So.
I mean, Nisara, with everything that's happening right now, like I was mentioning earlier, we see more and more people coming in with, I want to say, signs of dry eyes. I mean, again, the tearing up, like you were mentioning, people saying that their vision is not as sharp these days, and all these things. I mean, is there something we can help them with that right on the spot, or there's more digging that needs to be done there?
There's definitely more digging that needs to be done there. We have to find out what are the different reasons and factors that can cause this dry eye. There is a general treatment plan that we do give to patients. Of course, they all know about their artificial tears and drinking lots of water, but there are other treatments, which I'm sure we'll go into later. We basically have to think about why they're experiencing this dry eye. What are the different factors? There are intrinsic and extrinsic factors. There's, 2 different factors. And I'm sure you guys have noticed it in your clinics when patients come in, and like you say, Martin, patients come in and they're complaining about, their vision not being totally clear. So this is when I like to, kind of discuss these factors with these patients.
So Nisara, I know that, if I stand out in the wind a long time, my eyes will feel dry. I know that if I take an antihistamine or I drink too much coffee or alcohol, my eyes get dry. So maybe you could tell us about some of the causes, and I'm sure it's quite a list, but maybe you could lean it down a little bit for us and break it up into different portions so we can understand.
Absolutely. So I always start with the external causes first, because these are some things we can control. So external causes are, like you say, Lauren, environment, dust, and allergens. You're standing outside, there's possible dust and allergens that can get onto the ocular surface, which can cause the tear film to be compromised. Or if it's already compromised, then it starts causing that tearing effect. Things like contact lenses That's big with dry eye, which we will get into later. Cosmetics are a big thing. I'm sure we'll get into that a little bit later. Debris and chemical exposure. So people who work in dusty environments, people who work in construction, people who work in hospital settings, that are, there's some, they have to do some cleanup. And possible chemical exposures. So UV exposure, being outside in the sun all day. We've seen patients who come from very warm countries, tropical countries, and their eyes show signs of dry eye and scarring. And especially now during COVID, we are all using computers. We're all on our screens all the time. There's no home and work-life balance going on anymore. We're constantly checking emails, checking our, computers, iPads. Then we start watching a TV show on a TV screen. So screens also prevent your eyes from blinking. We are constantly staring at these screens, and these screens, when we're staring, there's no motion of your eyelids coming forward all the way down to the bottom lids and creating that windshield fluid effect where your whole ocular surface is now lubricated by your natural tears. And so our blink rates are decreasing because we're constantly staring at the computer. Topical meds, you mentioned antihistamines. Yes, like topical meds do that. I mean, there are certain, glaucoma meds that patients are on that cause dry eye. And honestly, that depends on the pH of these meds. So the pH levels on our cornea should be in the 7 range. And some of these meds have a pH in the 5-6 range, which can cause a lot of burning and discomfort. And it messes with the acidity of the tear film. So sometimes, we have to also use adjunct therapies while these patients are on these glaucoma drops. So we use things like Xiidra and Restasis, artificial tears, all these things, to help prevent that inflammation. But we'll get into that a little bit later, I'm sure. Lid structure is a big one. When patients have a lax lid and their lids don't blink completely or hold the tear film in the eye, and there's a little bit of drooping going on and the tears are just falling out. I've had so many patients say, I don't know why my eye is just watering and I look at their eyes and nothing's holding that tear on the ocular surface, because the lid should be opposed to the ocular surface and it should allow the tears to stay on there. And if they just drip out, then there's no protection of your ocular surface. And then finally, things like surgery. Surgeries can cause ocular surface disease as well. Things like a blepharoplasty, where we lift our eyelids. Sometimes we do it for cosmetic reasons. Sometimes we do it because it is actually blocking our visual field. When we lift our lids, it can prevent us from completing a blink. And when we don't complete a blink, we don't get a full boost of moisture on the ocular surface, and it can cause some drying. But also things like refractive surgery, like cataracts and LASIK, that can also play a role as well. And I think those extrinsic factors are a big player. And so when you have these patients come to your offices, come to your stores, they are looking at these glasses, you're dispensing them glasses, and they come in, they say, my vision's blurry. That's just the extrinsic factors. That's just the external factors that affect them, which I think is it's crazy.
It reminds me of a little bit of a story. I have a client. He came to my office and he said, "Martin, I have this freakish thing happening to me with my wife at night. She sleeps with her eyes open. It's freaking me out. But she has all these problems with her eyes because of that. And she has to put this like toothpaste almost looking gel on her eyes, so really she doesn't have all these dry eyes." And what you were saying there with the lids and everything else just reminded me of that. And
Yeah, so that is what we call lag ophthalmos, and it happens to some people at night when their lids are a little bit lifted and the whole bottom part of the eye is exposed to air. And normally on a day-to-day basis, we're blinking, we're constantly moisturizing that part of the eye. But at night, you don't know whether, like you don't really blink. You don't know what's going on at night when you're sleeping. And so we do have to put ointments and things like that, and recommend ointments that patients put that in before bedtime, just before they go to bed. So it keeps that area moisturized to prevent that dry eye or the disturbance of the ocular surface. And we also, there are other things that people do as well. Sometimes people tape their lids shut at night. And that's a big one. They just, it's medical tape. It's special tape for your skin. You just tape them shut. That's it. And that's how it works. Some people use masks. I am hot cold about, sleeping masks. So I don't really get into that right now. That's a whole other topic to talk about. But then there are other surgeries that can be done too. And I've, read about, putting gold bars on the lid to keep the eyes down. It gives a little bit of weight on the lids. And so it keeps the eyelid down. Again, that's an extreme case. But yes, when people sleep with their eyes open, it's a huge part. And now think about people sleeping with their eyes open and they have a CPAP machine that they use. And that CPAP machine is blowing air left, right, and center all into their ocular surface, and it completely dries out their ocular surface. And in the morning, their eyes are just completely puffy and red and irritated. And so anyway, so that's something I thought, plays a big role with ocular surface disease
So,
as well.
so lots of external factors. We could probably
Yes.
talk quite a bit more about that, but we
Mhm.
don't have a lot of time. So maybe we should dive into intrinsic factors.
Sure.
But I've heard that women suffer of dry eyes more than
Mhm.
males do, and I hear age has a factor. So why don't you give us some
Yeah.
ideas as to other reasons we get dry eyes?
Definitely. So age plays a big role, of course. The longer you are on this earth, the more wear and tear. So age definitely plays a role. Things like hormones. So yes, you're right. Females do suffer, unfortunately, more from dry eye disease because of the hormonal fluctuation. So there's premenopause, menopause, postmenopause, pregnancy, hormonal fluctuations related to polycystic ovarian syndrome, endometriosis, ovarian cysts, all these things play a big role. And just to kind of play off on that, birth control pills, that is another big thing. And they have it in teeny tiny writing on their little pamphlet that comes in saying may affect your contact lens wear. But birth control pills definitely affect dry eye. I thought I'd throw that in there. But other medications do as well. Things like hypertensive meds they're water pills. They dry you out. So, definitely cause dry eye. As Lauren was mentioning earlier, antihistamines dry out. They stop you from your nose from running, your eyes from running. So it definitely dries out the eyes. Things like Accutane, chemotherapy, depression meds. So those things all can play a role. In addition, stress. Stress is a big factor of dry eye, and we're all stressing out these days about everything. We have things like intrinsic chemical imbalances like vitamin deficiencies, malnutrition, mineral deficiencies can also play a big factor. Dehydration, like we had mentioned earlier. And finally, diabetes. Diabetes plays a big role in dry eye, along with thyroid disease and other diseases that can cause fluctuations in the metabolites in the body.
Nisara, you mentioned a number of drugs there, medications. I once heard that it was a big part of it is that it slows down your blink rate. So even a painkiller or anything that does anything with your nervous system, would that be true that you're just not blinking as much? You're not necessarily zoning out, but maybe you're not blinking as much?
Yeah, that is a possibility. That's definitely a possibility. And you find like even you know, like kind of like how Martin had mentioned earlier, when someone is sleeping, you know, they're not fully aware that they're not blinking or their eyes aren't completely shut. And just like this, possibly things that affect your central nervous system make you less sensitive. And so you don't feel the need to blink as much, which can also create that dryness as well. So there's a lot of different factors for sure. And every patient gets different side effects from these medications. So it's not totally textbook. But yeah, you're absolutely right. It can, anything affecting the central nervous system can definitely cause dry eye.
Before you get into, because we'd really love to know how you diagnose it, or, you know, when someone comes in with various problems, how you decide if it's dry eyes and what you apply your skills and that. Martin, I have something here for you. So we have so many patients come in complaining about different things. So here's a bit of a quiz for you, Martin.
Never complain, by the way. They're always nice.
They have concerns. Let's say they just have concerns. They're not complaining, right? They have a few concerns. So Martin, what are some of the symptoms people come in with? I know I can, off the top of my head, mention a number of them. I'm going to quiz you. What are some of the symptoms that your patients come in with?
Well, you know what, Lauren, there's definitely a multitude of them, but it really depends on what age they're at. I mean, my 80-year-old patient client will come in, and as we talked earlier, the constant tearing up and not understanding exactly why. And then I have the 15-year-old that just spent all night playing Fortnite, that just saying that my eyes are burning and I can't see as well. We see a little bit of everything, and especially lately with the masks, people that wear masks all day, every day seems to have much more dry eye signs or symptoms than people that, let's say, are staying home and, you know, don't wear the mask as much. Have you noticed that, Nisara, at all?
Absolutely. So you're totally right. The symptoms start with masks for sure. There have been studies done in 2020, recent studies, that masks can cause increase in dry eye symptoms. Things like burning of the eyes, tearing, redness, itching, sandy, gritty feeling, just because of that awareness of air puffing out from the top of the mask into the ocular surface. So the other thing that I've also seen is that when people wear their mask, they wear it all the way up, and it sometimes even like is touching that eyelid margin, which I don't understand how they can walk around like that, but it happens. And sometimes it's to prevent the fogging of the glasses and just having that comfort, you know, to see. But again, this can also create some friction on the ocular surface. So masks are, for sure, they do cause dry eye. And you know, personally, when I'm at work, I like to tape my mask down. I wear glasses, and I find that my mask does bother my eyes, and it does create some dry eye type of feeling for me. And you know, it fogs up all my lenses, my glasses, my oculars, everything fogs up. And so I end up taping my mask down. And when I tape my mask down, I have to be very, very careful, because you end up pulling your eyes down a little bit from the bottom. And when that happens, it can create that lag ophthalmos again, preventing the tears to stay on the ocular surface, preventing complete blinks of the eyes. And, you know, this is something that that I would say be aware of it and make sure you're taping the mask down a little bit toward your cheeks.
Yeah, I heard that if you have dry eyes or fogging glasses, your mask isn't fitting properly. That makes sense. You're letting it all come out, and you're defeating the purpose of wearing a mask if you're not. I guess double masking is being used more and more to try to keep your breath coming through the mask instead of out the sides of the mask.
Definitely.
Your eyes. So Nisara, tell us. So okay.
I'm just gonna interrupt you there for a second. I just want to make sure, though, that everybody understands here. We're not saying not to wear your mask because it's going to create dry eyes, right? Don't take it that way. Do wear your mask. It's definitely a lot healthier for you to wear your mask and protect yourself than the little bit of dry eyes that we can get from it.
I agree,
Definitely.
Martin. We want to be put in that group where we're denying something here.
Exactly. Because that's
Yes.
not what we're saying at all.
No. No, definitely wear your masks. I have patients come in and, they take off their masks because they think that, and it's inappropriate to do that. You have to protect yourselves, you have to protect everybody, you have to protect your loved ones. Definitely wear your mask, but there are ways to help prevent the dry eye from affecting you with mask wearing. So, you can use your artificial tears. You can take socially distanced breaks from the masks when you're outside. You can stay indoors or in your backyard or in a park somewhere and just take that break when you need it. But medical professionals, I find, the ones who are wearing their masks all day, frontline workers who are wearing their masks all day. Yes, by all means, you should tape your mask down if it's causing you issues, but be aware not to pull your lower lids down too much because that can also exacerbate the dry eye. So when I say, yes, it can cause dry eye, just be aware that long-term mask wear can, in some patients, affect their ocular surface. So please wear your masks. Definitely wear your masks.
Or
Thank you, Nisara, for making sure that everybody understands.
I agree with you. So now the patients come in, they've told you about their symptoms, their concerns. What protocol do you do now? How do you decide if they have dry eye disease? There must be something you go through, a routine that you go through.
Yeah, so in fact, I use both signs and symptoms of dry eye disease. So like we had said earlier, the burning, itching, redness, tearing, sandy, gritty feeling in the morning, transient blur, fatigue and strain, glare, especially when driving, when the air is blowing up at your eyes and drying out your ocular surface. I use the dry eye questionnaire on my patients. So it's a standard survey. It's used across the board with eye care professionals. And it's just 5 or 6 questions that we ask them and we score them based off of their symptoms and how severe their symptoms are. And then again, some patients do not have any symptoms, but they're showing me signs of dry eye. So when I do their eye exam, I look at things like vision fluctuations during the visual acuity testing, as well as looking at their auto K Myers and making sure when I do, have them look at the little balloon or the little farm down that, down that path, I look at how those circles in that test are looking. And, we see on blink, do they clear up? And then do they distort again? I look at things like the non-invasive keratographic breakup time called the NICBUT and look at the distortion of these discs. So that's, again, another test. We also, for people who don't have these tests, can use the fluorescein breakup time, the tear breakup time using the fluorescein. And so that is also, I find, another important one for people who don't have these fancy machines. Again, I really focus in on the lid margins and the anatomy of these glands. So I find meibomian gland dysfunction to be quite common. I feel like when I see my patients, probably 65 to 70% of patients in my day-to-day practice have meibomian gland dysfunction. And we look for also, in addition to that, the blepharitis or the little deposits of biofilm on the tear or on the hair follicles of the eyelashes. We look for SPK or little dry spots on the ocular surface and conjunctival staining of whether it's lissamine green that we use or sodium fluorescein that we use. The staining gives us a lot of information as to what type of dry eye this patient is experiencing. To go further into dry eye assessment, I use this test called Inflammadry that measures the MMP9 protein. So this is called the metallomatrix 9 protein. It's a fancy name. Basically, the higher it is, the more present it is, the more inflammation present on the ocular surface. And I also look at the osmolarity levels in the tears, which tell us if the tears have too much salt present and a decreased amount of water. Meibography. So as we speak of the meibomian glands, it's like an infrared picture that we take of these glands. And I love this scan because I can see if the glands are engorged, if they're dying off or atrophying, if they're curling, if they're presenting themselves again after treatment and renewing again. So again, you know, I love these tests. It really helps me, and I recommend these tests to certain patients, not all of them, of course, but I wish I could do them on every single patient. And I like to show them this, and it makes the biggest difference in their motivation to complete the dry eye therapy, whether it's at home or in clinic. So there's a lot of things a lot of intricate things I look at during the examination, just of the ocular surface. So,
Sarah, I'm going back a number of years. I'm just
yeah.
curious if this test is still done. Little strips of paper are hung in just inside the bottom lid, and you see how much it wets down. Are
Mhm.
those little strips still used?
So in some clinics they are used, but what we're finding is that they're inducing discomfort and dry eye on patients, and you're messing with the ocular surface just by having these strips present on the ocular surface. So they do not have these tests highly recommended anymore. I definitely don't use them because sometimes you would need to put an anesthetic into the eye for patient comfort, and then how do you know if that watery part is from the anesthetic or from the patient's tears? So there's a lot of, I find there's a lot of negatives to that test than
Yeah.
positives. But yes, you're absolutely right. These tests have been used in the past, and some docs still currently use them. And I'm not saying they're bad tests. I'm just saying there's better out there.
Sure sounds the way, especially I used to always think when you're putting a paper and if you poke someone, they're going to start tearing up.
Exactly.
That's, so you're defeating the whole purpose of it.
Sarah, maybe even Lauren, before we let you go, I mean, we can do recommendations to patient all day long, and sometimes they're very great and they follow everything that you say, and you have a winning plan going forward.
Mhm.
There's some people that unfortunately don't necessarily adhere to recommendations that we make.
Mhm.
What happens really at the long run if somebody does not treat their dry eye symptoms?
Yeah, that's a really good question. So it all depends on, again, like we spoke about, the extrinsic and intrinsic factors, their signs and symptoms. But let's say this patient has severe dry eye and they're not willing to do any of the treatments. They can get serious vision issues, a lot of discomfort just being in their own eyes, like just looking through their own eyes. They get that discomfort. These patients can feel that their eyes are just so uncomfortable. They can get some swelling around the lid margins. They can get a lot of scarring on the ocular surface, and then small changes in life, like for example wearing a mask. If certain patients have treated their dry eyes or are currently in the midst of treating the dry eyes, the mask won't be a big deal for them. However, patients who have severe dry eyes and are not treating them, the masks will be an issue for them. Same with things like surgeries. So for example, if this patient later on in the future needs a cataract surgery, the cataract surgeon will probably say, you have to fix your dry eye before I do the surgery itself, because it's going to cause you so much discomfort when you're putting these drops in the eyes for recovery, or when you are, once we finished up the full surgery and you're healing up from the trauma of the surgery, you may not get a completely clear vision in through those intraocular lenses, because your ocular surface is so scarred up. So there's a lot of things that can be a problem if you don't treat this dry eye. So,
and speaking of that, we would be remiss if we didn't bring it up because we are contact lens practitioners. So a lot of times we'd talk to people when we're doing our workup and our history. And like Martin said earlier, we'll say, do you have any dry symptoms? Oh no, I'm a great candidate. My eyes tear like crazy, which we know that that's not a good thing. It's tearing for a reason, probably because they're so dry and irritated, that they're tearing. But we noticed that once people start wearing contact lenses, am I right to say that if you were a marginal dry eye patient, you start sticking a soft contact lens in the eye, we could exacerbate the situation?
definitely. So I will always look at a patient's ocular surface before I fit them in a contact lens. And some patients are stubborn. Yes, they're stubborn. They still want their contact lenses. But I find that if you stick them in a contact lens when the eyes are dry, it is causing friction on the tear film and the lid margins, which are already inflamed and already affected by their initial dry eye, whether it's mild, moderate. It disturbs the tear film, and it can decrease blink awareness as well. So in addition to, having this ocular surface issue, you're putting a contact lens on there. You don't even blink anymore, so you can't even fully lubricate the eye, lubricate the contact lens. And then patients, these days will overwear their contact lenses, and sometimes they don't even wash their hands when they're taking their contact lenses in and out. And people sleep and shower in their contact lenses, which is an absolute no-no. So all these external factors are now getting into the eye, which is already affected and compromised by the disturbed tear film. And then the contact lens causes friction, and then you're now more inflamed, and then you get less wear time. You don't want to wear your contact lenses as much, or if you wear them, your eyes are extremely dry and uncomfortable. And we don't want your corneal nerves to be affected and exposed. You don't want your cornea to be scarred up. So yeah, this, it's very important to treat your dry eye before fitting patients into contact lenses. And if a patient is good and stays on this dry eye bandwagon, then they actually get more wear time out of their contact lenses. They get almost 4 or 5 hours more wear time, and comfortable wear time, not like I want to pull these contact lenses out of my eyeballs type of wear time. And their vision is clearer through the contact lens as well. So yes, it is so important to treat the dry eye before wearing contact lenses, because contact lenses can exacerbate dry eye, in addition to other things as well. So
yeah, I guess because not only do you have to lubricate and hydrate your eye, but that contact lens, a soft one, is a little sponge. So you have to have enough tears there to keep that sponge happy, I guess.
Exactly.
Yeah. So very important, very important. So Nisara, this has been great. I want to thank you for coming out today to talk about dry eyes. I think there's a lot more that we could talk about, even going deeper into diagnosing. And we didn't really we touched upon a little bit, but we didn't talk about treatments. So maybe we can have you back another time and we could talk about treatments, whether it's topicals, whether it's, pills, whether it's, just compresses, whatever. Anyways, I'm just throwing it all out there. So maybe we could have you back to talk about that. We'd love to do that.
Yeah, absolutely. I would love to be here.
So again, I want to thank you for coming out today. Martin, do you have anything else to say to Nisara before we let her go?
I always have something to say, I guess. But yeah, no, Nisara, it was great having you here today. Lots of information. I think our listeners will be able to Google a lot of this stuff as well going forward. And I'm going to go and Google about those gold bars on top of the eyes. That's interesting. Never heard of that before. But again, thank you so much. I'm really looking forward to having another conversation with you about different things about dry eyes.
It was a pleasure. Thank you so much for having me.
Thank you, Nisara.
Well, wow, that was great today. Thank you again so much, Dr. Nisara Bandali. At the same time, right now, we have a quick message by Sierra from our sponsor, Novartis Ophthalmology.
Thanks, Lauren Martin and Dr. Bandali. That was a very informative episode on dry eye disease. Now, you guys may be wondering where you can go to find out more on dry eye disease and how to connect with that healthcare professional. Well, that's where ilove.ca comes in. ilove.ca is the online tool providing more insights, videos, and even a quiz to learn more about dry eye disease. After all of that education, we know you guys are going to find out about, we even have Emily, our chatbot, to help connect you to a dry eye disease expert in your area. Visit ilove.ca, spelt EYELOVE.ca for all of this and more.
Thank you so much, Sierra. That was a great message. Again, everybody, make sure you visit ilove.ca. That's brought to you by Novartis Ophthalmology to get more information about dry eye diseases. Lauren, again, what a great episode, I think. Any last word before we go?
Well, I have to agree with you. Was a good episode. I learned quite a bit. I thought I knew quite a bit already about dry eye. I have a better understanding of what brings it on and some of the symptoms. And I'm looking forward to a future podcast where we can talk about more treatments so we can give people advice on that. So anyways, Martin, great to see you. Hey, everybody, thanks for joining us. We'll see you on our next episode of See What We See with Lauren and Martin. Goodbye, everybody, and stay safe. Thank you for listening to See What We See with Lauren and Martin. Be sure to follow us across our social media pages so you never miss an update or an episode. You can find us on Twitter at OOA_frontline. On Facebook and LinkedIn, we are Ontario Opticians Association. Follow us on Instagram at Ontario Opticians Association. That's all one word. We look forward to seeing you again on See What We See with Lauren and Martin. Take care and stay safe.